Welcome. Today's webinar is entitled Older Adults Managing the Cost of IBD Medications and Treatments. This is through the Crohn's and Colitis Foundation, and my name is Christina Ha. I'm part of the Inflammatory Bowel Disease Center at Cedars-Sinai in Los Angeles. These are my disclosures, and let's get right into today's goal. Today's goal is to provide an overview on available programs and opportunities to help older adults manage the costs of inflammatory bowel disease care. First, let's discuss the costs of living with IBD in the United States. In May of 2019, the Crohn's and Colitis Foundation published an important study that looked at the costs of IBD care in over 50,000 patients. They looked at costs that were paid by the health plan, but also costs that were paid by the patient, including deductibles, copays, coinsurance, as well as the combined costs. And what they first found was that the healthcare costs for IBD patients are more than 3 times that of non-IBD patients per member per year of paid claims, with the IBD patient paying an average of $23,000 per year compared to the non-IBD patient's annual expenses of around $7,000 per year. IBD patients also have twice the out-of-pocket costs than non-IBD patients, paying over $2,000 of out-of-pocket costs per year compared to less than $1,000 for patients without IBD. And this doesn't even cover indirect costs such as lost wages, time for caregivers, child care, or transportation for health care. So this likely underestimates a patient's out-of-pocket costs. And we also know that the overall costs have increased in the past 5 years, driven in large part by higher costs of medications. The cost for IBD is really essentially higher for patients in transition, and these are children diagnosed with IBD and patients at the age of 65 who have up to 46% higher cost burden. As such, there's an immediate need that we identify cost-effective strategies to reduce this burden of costs for our patients and families affected by IBD. So we're going to be covering 5 strategies to help manage your IBD costs. First, purchasing coordinated or supplemental Medicare insurance. When you transition over to Medicare, you have the option of purchasing coordinated or supplemental Medicare insurance that can help cover out-of-pocket expenses. The second thing is enrolling in federal and state savings programs, and we'll review the enrollment process for these programs. The third is we're going to discuss financial assistance programs that are available from manufacturers to help patients who demonstrate a financial need pay for their out-of-pocket expenses. Next, we will share resources for grants, foundations, and other assistance programs that offer additional opportunities to apply for financial assistance. Finally, we will provide a general overview of disability programs, what they are, who is eligible, and how to apply. So the first step is to discuss applying for coordinated or supplemental Medicare insurance. For those who are on Medicare, many people with IBD will find it important to purchase coordinated or supplemental plan such as Medicare Advantage, which is a coordinated care plan, or MEDIGAP, which is a supplemental plan. However, before making any decisions, it's very important for you to make a list of your anticipated healthcare needs. The Crohn's and Colitis Foundation has an excellent IBD health insurance checklist that you can use to jot down your preferred providers, hospitals, as well as anticipated treatments and medical services. So when we talk about Medicare options, there's really 3. First is Original Medicare, the second is Medicare Advantage, and the third is MEDIGAP. And we will go through each coverage options in the next slides. As you may know, as you approach the age of 65, you enter an enrollment period, which begins 3 months prior to and 3 months after your birthday, where you must apply for Medicare. Medicare is a health insurance program run through the federal government for people who are over the age of 65, as well as younger people with certain disabilities. In addition to Original Medicare, you do have the option of purchasing additional insurance, and these are the Medicare Advantage or MEDIGAP programs. And these are important plans to consider as they may provide additional health care coverage and benefits that are necessary for people living with Crohn's and colitis. But first, let's review what Original Medicare covers. So again, Medicare is a federal health insurance program for people who are 65 or older and certain younger people with disabilities. there are different parts of Medicare that help cover specific services. The first is Part A, and that covers inpatient hospital stays, care in skilled nursing facilities, hospice care, and some home health care. Part B covers certain doctor services, outpatient care, medical supplies, and certain preventive care services such as immunizations and vaccinations. Medicare Part D adds prescription drug coverage to original Medicare, some Medicare cost plans, and some Medicare private fee-for-service plans, as well as medical savings account plans. These plans are offered by insurance companies and other private companies approved by Medicare. But let's go into a deeper dive into the different types of secondary or supplemental coverage you can opt into to help pay for some of the costs not covered by original Medicare. The first is a Medicare Advantage plan, or also known as Medicare Part C. And what it is, it's an all-in-one alternative to original Medicare that includes Part A, Part B, and Part D. However, it's important to know that the cost and the availability of the plans may vary by state as well as by insurance companies. Instead of paying for just Parts A, B, and D, a person would enroll in a Medicare Advantage plan through a private insurance company. This can be an HMO or a PPO that in many cases covers all the services provided by Parts A, B, and D, as well as additional services. The beneficiary or the patient would pay the Medicare Advantage premium along with the Part B premium in most cases. But it's important to note that if you live in various states throughout the year, also known as being a snowbird, this plan may actually be challenging due to state-by-state limitations in terms of coverage. Let's compare that to MEDIGAP, which is Medicare Supplemental Insurance. It's important to know that Medicare Part B only covers 80% of medical expenses. A Medicare supplement or secondary insurance, also known as the MEDIGAP policy, helps pay for some of the health care costs that original Medicare doesn't cover, such as co-payments, co-insurances, and deductibles. The way it works is that your doctor will provide a medical service and they'll bill Medicare. Medicare will pay the approved portion of the bill and send the excess amount to MEDIGAP. And your MEDIGAP plan will pay the excess amount left over according to the plan's terms. However, even with the supplement insurance plan, you're not necessarily covered for everything, and you'll still have certain out-of-pocket expenses associated with your MEDIGAP coverage. Your costs will depend on your specific plan type, your insurance company, and where you live. There are a variety of MEDIGAP plans available, and they all offer different coverages. MEDIGAP policies are sold by private companies, and Medicare is considered the primary insurer, whereas MEDIGAP is the secondary insurer. So what are the key differences between Medicare Advantage and MEDIGAP? The first is cost. Medicare Advantage plans generally cost less, but in terms of MEDIGAP, the higher monthly premiums may result in lower out-of-pocket expenses down the road. In terms of choice, Medicare Advantage plans generally limit you to the doctors and facilities within the HMO and PPO, and they may or may not cover any out-of-network care, which is important if your providers and your care team are within that particular Medicare Advantage plan or not accepted. Whereas MEDIGAP and Original Medicare cover if you go to any doctor or facility that accepts Medicare. And there's also lifestyle. Medicare Advantage plans tend to operate within a certain region only, whereas MEDIGAP plans, in combination with Medicare, may be better if you tend to move from one state to another throughout the year in terms of a lifestyle convenience in order to ensure quality access to health care. So step number 2, if eligible, apply for state and federal Medicare assistance. So let's discuss the various state and federal assistance programs. First, there are Medicare savings programs available through the states. Medicare savings programs assist with covering premiums. If you have or are eligible for Part A and you have limited income and resources, then you should call your state's Medicaid program to see if you qualify for one of the Medicare savings programs. The way to do this is to look for the state's health insurance assistance program sites. This is a federally funded health advisory program that provides grants to all 50 states and some territories to provide health insurance counseling to Medicare recipients. They provide free one-on-one telephone counseling and advice services, personal face-to-face counseling sessions, public education programs, and media presentations. Most SHIP counselors are volunteers who have received extensive training and are well-versed with all facets of the Medicare program, including Part D, Medicaid, health insurance benefits, fraud, and abuse. There's also the Medicare Extra Help Program, or the Low Income Subsidy Program, which is a federal resource. Medicare Extra Help Program is for Medicare Part D recipients and Medicare Medicaid dual eligible recipients who have limited income and resources to help pay for prescription drugs. Step number 3 to consider is to apply for financial aid through drug manufacturers. However, it's important to know that there's different types of assistance. The one that we may be most familiar with are the drug copay discount programs. However, those are only available for patients with private insurance. Once you've actually enrolled in Medicare, you are no longer eligible for these drug copay discount programs. But pharmaceutical companies may have financial assistance programs to help offset the costs of certain medications. There are also other programs that may help with lab testing assistance as well as colonoscopy services, although they tend to be screening, not diagnostic colonoscopies that are covered, ostomy supplies, and enteral therapy assistance. Enteral therapy is essentially liquid nutrition, sometimes given through nasal feeding tubes or gastric or jejunal feeding tubes to help provide additional nutrition support to people who aren't able to obtain all of their calories through oral nutrition. Again, it's very important to emphasize that when you switch from private insurance to Medicare, you are no longer eligible for drug manufacturers' copay cards. As an example, if with a copay card you're only paying $5 a month for that prescription and you transition over to a Medicare-based plan, that $5 a month copay card is no longer a service that you can utilize. However, there are additional pharmaceutical financial assistance programs. However, they typically help patients who have the following, which are limited income or resources, who are underinsured, or sometimes for people who do have commercial insurance but cannot afford the drug or were denied the drug by their insurance companies. It's very different from copay assistance, as you need to demonstrate financial hardship or financial need when you apply for these programs. And where can you learn more about these programs? There's the manufacturer websites, but there's also a lot of information on the Crohn's and Colitis Foundation's website, www.crohnscolitisfoundation.org, as well as the NeedyMeds website, needymeds.org. And don't forget to engage your healthcare team. They can oftentimes direct you to resources to help offset some of the costs of medical care. There are also additional assistance programs for other services beyond just medical therapies. For example, colonoscopy cost assistance. The first thing you can do is you can contact your state health department for government-funded programs or reach out to nonprofits like the Patient Advocate Foundation or Colonoscopy Assist. However, it's important to note that these services usually cover colon cancer screening colonoscopies, and most of the people living with Crohn's or colitis have diagnostic colonoscopies that require biopsies to assess for disease activity or response to treatment, so you may not necessarily be eligible for these cost assistance programs. However, this is where it's very important to engage with your healthcare team. There may be an alternative study that is appropriate for your care considering the costs, such as sigmoidoscopies, certain lab tests, or stool testings that may be used in addition to the routine endoscopic testing to assess for response and remission. It's important also to be aware that in addition to the costs of the procedure itself, there may be facility costs, anesthesia fees, or provider fees that may be separate and not included with certain assistance programs. For our Crohn's and colitis patients living with ostomies, insurers will usually pay for a certain quantity of ostomy supplies each month. However, if you have high output, exceed your monthly allotment, or you have difficulty with your seal or skin irritation and require more frequent changing of your ostomy appliance, these excess supplies may not necessarily be covered by insurance. To inquire about additional assistance to help or provide free ostomy supplies, you can reach out to the ostomy companies themselves, such as Convatec, Hollister, or Coloplast, but also websites and groups such as the Osto Group, ostogroup.org, Friends of Ostomates Worldwide, www.fowusa.org, and the United Ostomy Association of America, www.ostomy.org. They provide great resources to help direct you for assistance in obtaining the additional supplies that you need. For those of you who are on enteral therapies, which means that you're receiving nutrition support to provide additional calories that you need due to malnutrition, short bowel syndrome, fistulas, or whatever your healthcare team has determined is necessary to expedite your healing, there are a number of organizations in the Foundation's database that can help provide financial assistance if your insurance or your coverage isn't adequate. An example is the OLE Foundation, which assists with requesting and donating feeding supplies, and their website is oley.org. There are also some resources to help with dental assistance. IBD patients can have oral health issues due to steroid use, vitamin deficiencies, and malnutrition. Additionally, many of our patients are also on immunosuppression, which can increase risks for infection. Therefore, maintaining optimal oral hygiene is very important in terms of healthcare maintenance when you're living with IBD. Some of the resources that are available include the Dental Lifeline Network, dentallifeline.org, and the Department of Health and Human Services also has a network of free and low-cost medical and dental centers for those who are uninsured and underinsured. Step number 4, investigate grants, foundations, and other assistance programs. There are a number of opportunities out there to obtain funding or supplies to help cover costs of care. For example, the Patient Advocate Foundation is an excellent group with a copay relief program, copays.org. The HealthWell Foundation, healthwellfoundation.org. Patient Access Network Foundation, panfoundation.org. Modest Needs Foundation, modestneeds.org, and NeedyMeds, needymeds.org. Great resources to check out in order to find opportunities to help complete your care. Additional recommendations that are important for everybody to help lower costs is to comparison shop. You want to compare prices and select in-network providers. And always ask if your labs and support team members, not just your gastroenterologist, but your primary care physician, gynecologist, endocrinologist, rheumatologists, are all in network. Also, it's important to recognize that different pharmacies charge differently, so it's important to shop around. Oftentimes, online pharmacies can provide less expensive medications. For example, you may be able to receive a 90-day supply of your medications through a mail-order pharmacy for the same cost as a 30-day supply, as not all medication costs are the same, even if it's the same medication, same dose, and same number dispensed. You can ask your provider for free samples. Sometimes they may have them in the office. However, depending on various institutions or hospital restrictions, they may not be able to provide samples anymore. Also, be sure to check your bills for errors or overcharges. Billing advocates and other health professionals estimate up to 80% of medical bills contain errors, according to the Medical Billing Advocates of America. So be sure to check your bills for errors and overcharges and contact your insurer with questions. Finally, engage your healthcare providers to help advocate for the services and medications that you need. Appeal insurance decisions if they decide not to pay. Talk to your healthcare team. They can oftentimes contact the insurance companies and also provide some tips and techniques that you can use to help engage the entire team to request an appeal or to overturn a decision. And finally, and I would say that this is probably the most tricky, if eligible, apply for short or long-term disability. We oftentimes receive questions regarding disability, and it's very important to emphasize that the vast majority of IBD patients do not require disability, as our goal with treatment is for our patients to have uninterrupted high quality of life, be able to work a full day at their jobs, to maintain their functional status, and be independent of all of their activities of daily living. However, a small percentage of people are unable to work due to the complexities and the complications of their disease. And we'll go over the specific programs for disability in further detail. There are two programs available through Social Security. There is Social Security Disability Insurance and Supplemental Security Income. Remember, having a diagnosis of inflammatory bowel disease, whether it be Crohn's disease or ulcerative colitis, does not automatically make you eligible for Social Security Disability Insurance. This is really only appropriate to consider if your healthcare team has determined that you have complex, severe, complicated disease that makes you unable to work for greater than 12 consecutive months. Many patients with IBD, even those with severe disease, are in and out of remission over periods of time lasting less than 12 months. There's also Supplemental Security Income, or SSI. This is for low-income individuals who have never worked or have not worked long enough to qualify for Social Security Disability Insurance, and this is a needs-based program. Again, the challenges with SSDI is, again, you're not eligible solely for having a diagnosis of IBD, and you should be expected to be unable to work for 12 consecutive months or more. It's important to recognize that there's a high rate of rejection. Almost 2/3 of all claims are rejected the first time around. Now, you can appeal, and there are resources to help with the appeals process and to learn more about the process for applying for disability insurance. And one option is a national organization of Social Security claimants representatives, www.nosscr.org. There's also short-term and long-term disability insurance, which is usually a benefit that is oftentimes employer paid. Short-term disability, the duration is typically 9 to 52 weeks, and it can be used if you are ill or injured and cannot perform your job's duties. The insurance will pay a percentage of your salary for a specified period of time. Long-term disability covers a percentage of your salary, oftentimes 50 to 60%, but this can vary depending on the policy. These benefits continue until age 65 or your retirement age under Social Security, or until you are able to return to work. However, if you are able to work but have concerns about missing work due to unexpected flare-ups of your symptoms or due to the need to attend health care appointments or procedures, you should be aware that the Family and Medical Leave Act entitles eligible employees to take unpaid but job-protected leave for up to 12 weeks in a 12-month period to manage a serious health condition. You can typically obtain this paperwork from your Human Resources Department and discuss your concerns further with your healthcare team. The process of navigating disability coverage can oftentimes be tricky. If you're unable to work but unsure about which disability option is right for you, talk to your IBD team about your disease and expectations for your disease activity. We should be doing this on a routine basis at every office visit anyway. Your healthcare team should be able to share with you their expectations about your ability to return to work over the next year. But if you need more information, feel free to contact the Patient Advocate Foundation's Jennifer Jaff Caroline at 844-244-1312 for more information. We oftentimes get asked a lot of these questions about medications, vitamins, and travel expenses. Question number 1 asks, can I safely purchase medication online or outside the United States? Medications bought over the internet from foreign sources or from storefront businesses that offer to buy foreign medications for you, or if you purchase them during trips outside the United States, may not be safe or effective. These medications may actually present health risks, and the Food and Drug Administration cannot ensure the safety of medicines that are purchased from these sources. The FDA can also not help you if you have problems with these medications that you get outside of U.S. regulation and oversight. The U.S. FDA also warns that there are many rogue online pharmacies that claim to sell prescription medications at deeply discounted prices, often without requiring a valid prescription, which should raise a red flag. These internet-based pharmacies often sell unapproved or counterfeit medications outside the safeguards followed by licensed pharmacies. These rogue sites often prominently display a Canadian flag, but they're actually operated from the other side of the globe with no connection to Canada. Medications bought from these websites can be dangerous and may put your health at risk. If you have difficulty finding coverage for your maintenance medications, please be sure to contact your healthcare team, as we can utilize resources or potentially even alternative medications that are equally safe and effective to address your Crohn's and colitis needs. Question number 2, I take a lot of vitamins and probiotics that are very expensive. How can I get coverage for this? Unfortunately, most of the time, vitamins, probiotics, and medical foods are not covered by insurances. You can ask your doctor for a prescription, particularly if you're experiencing weight loss or malnutrition or you have a documented deficit. However, it does not guarantee or result in coverage. What about travel? If you have to travel far distances to your medical care, can you apply for assistance? There are a variety of programs that you can apply to that can help assist paying for gas, airfare, and lodging, such as the Air Charity Network, Angel Flight, and Mercy Medical Angels, which are all foundations you should look into. For additional help and resources, please utilize the Crohn's and Colitis Foundation's IBD Help Center. It's available by phone, 1-888-MY-GUT-PAIN, MYGUTPAIN. It's available Monday through Friday, 9 a.m. to 5 p.m. Eastern Time. And you can also email them with your questions at info@crohnsandcolitisfoundation.org. There are also a number of organizations that we discussed in this presentation that will be helpful for you. 2 examples are needymeds.org and the Patient Advocate Foundation, that are 2 Crohn's and Colitis Foundation partners that provide information on patient assistance programs and guidance on insurance resources. Finally, and most importantly, always discuss your concerns with your healthcare team. They do understand the costs of managing IBD, and they can share knowledge on making smart, affordable choices. They can assist in applying for cost-saving programs, and they can file an insurance appeal on your behalf. Thank you so much for tuning in to today's webinar. Hopefully you've learned about some available resources to help you navigate through the insurance space. For additional information, please feel free to reach out to the Crohn's and Colitis Foundation's website for additional amazing information. Thank you.